Welcome to the next module in our Professionalism series. In this module, we will be discussing the importance of social awareness. The goal of this module is to introduce the topic of social awareness and how it relates to the field of communication sciences and disorders. Social awareness refers to the ability to empathize with others from diverse cultures and backgrounds. This includes recognizing cultural and behavioral norms that vary across different races, cultures, religions, and backgrounds, as well as respecting these differences across the lifespan. As a professional, it is also important to be aware of unconscious personal biases. To be socially aware, it is crucial to be respectful to people of all cultures and backgrounds. This includes patients, their families, and fellow employees. Many factors can affect the behavior of an individual, such as culture, ethnicity, race, religion, gender, sexual orientation, and even age. Showing openness to learning about a patient's background and perspective is key to providing the best care possible. Each specific culture has diverse cultural norms or behaviors that are considered appropriate. What is considered polite in one culture may be rude in another. For example, in the United States, it is especially important to arrive on time, but in Mexico, it is more proper to arrive a little later so that the other party does not feel rushed. Therefore, it is important for us, as future professionals, to observe and understand cultural, religious, and gender norms outside of our own. Being socially aware also comes with the responsibility of advocating and supporting those of diverse cultures and backgrounds. This would mean stepping in and speaking out on cultural issues within the workplace, whether that be for a patient or a coworker. Let's discuss some guidelines to follow in order to be a sensitive and respectful advocate. Keep in mind to be respectful of boundaries and always ensure that those you are advocating for are comfortable with it and have given you permission to advocate on their behalf. Make sure not to speak over them, but be an active listener and engage in a meaningful conversation. Respect their wishes and always act within the scope of practice. It is also important while having such a sensitive conversation to monitor, register, and tone. Lastly, it is important to reflect on your own actions and identify any unconscious biases you may have. Self-reflection involves an individual's ability to reflect on personal situations, seek guidance or change, and show growth in areas of deficit. Reflection will help you to become more socially aware and sensitive to cultures other than your own. Always show openness to feedback from those around you, especially clinical supervisors and instructors, patients, and peers of diverse cultures and backgrounds. Be sure to be an engaged and active listener. The practice of self-reflection helps to identify behaviors that are helpful to growth and development as a person and as an allied service provider. Self-reflection is an opportunity not only to identify focus areas, but also to the behaviors required to elicit change. Be honest with yourself and your capability for growth and improvement in this area. Remember, you want to be a clinician that your patients and coworkers can rely on for support in times where they may feel vulnerable.